So, evidence for the systematic Israeli attacks on Palestinian healthcare personnel and the destruction of preconditions of public health and for public health is our next topic, and the speaker is Dr. Mads Gilbert.
Yeah, thank you.
At least try to speed up.
I will. Absolutely. Can I have the first slide, please? Assalamu alaikum. Good morning, everyone. Respected jury, thank you so much for the invitation and the honor to be a witness here. My only justification to stand here in front of you today is to amplify the Palestinian voices and to support and to extend on their experiences. I start by paying tribute to three of my dear colleagues in Gaza, because within all these numbers we have, Palestinians are of course not numbers, but humans with families just like us. The late Dr. Haitham and Dr. Samera, who were brutally murdered with their 5 children on December 16, 2023, and my dear medical student and later very clever medical doctor, Dr. Maysara Al-Rayyes, who was killed on the November 5th, together with his complete family in Gaza City. We should remember all of the 1,700 plus healthcare workers who have been killed brutally by the Israelis, and all the other more than 80,000 killed. And the killing goes on as we are speaking. I also want to pay tribute to the brave colleagues, the Palestinian medical students, the paramedics, the nurses, the doctors, and all the others needed for a healthcare system, who are, as we are speaking, doing their heroic work to serve their people under the most difficult circumstances, like Dr. Atef Al-Hot here, the medical director of Nasser Hospital, confronting the Israeli invading armed forces into his hospital. I want to try to give you a testimony on the systematics of the Israeli attacks on healthcare, not just for the last 2 years, and the systematics in the Israeli destruction of the preconditions for public health, because this has been going on as a modus operandi from the Israeli settler colonial politicians and their army for more than 40 years. And I think I would like to quote one of my good colleagues, the previous Deputy Minister of Health, who said that the most important health issue in Palestine is the occupation. And as medical professionals, we need always to seek the root cause for ill health. And I totally subscribe to the fact that in Palestine, the root cause of ill health is the Israeli occupation. And unless that is dealt with, there will continue to be ill health. And being doctors going there only to soak the blood from the floor, we will become part of the problem if we don't stop the bleeding. The Palestinian healthcare workers are experts in improvising and finding solutions. In fact, the world experts. They should teach us. They carry the weight of healthcare in occupied Palestine, both Gaza and the West Bank, and they are the key witnesses. That's my position. And I will share with you some of my own experiences through the 42 years that I have been working as a medical doctor, anesthesiologist, and emergency doctor with the Palestinians. So as a scientist, I want to share my sources with you and what is the basis for what I call evidence-based solidarity. Number one, my local contacts, the families, the patients in Gaza and in the West Bank that I have been dealing with. And of course, my own clinical experiences. The Minister of Health in Gaza, the UN bodies that are providing regular reports, the critical media, and of course, peer-reviewed, evidence-based research and science. So I'd like to point to the fact that throughout the 2 last years, we've had weekly updated reports on any number that could be gathered in Gaza through in particular, UN-OCHA's reports, the weekly reports, and all the reports, validated reports on the attacks on the healthcare system. And in addition, the science. There has been a large body of peer-reviewed science published through the last 2 years, and I'd be happy to provide the jury with an updated list of references. So the most important source of knowledge, I think, is this UN-OCHA weekly report, and they have produced nothing less than 328 such reports since the 7th of October. And if you look at this graph, you can see the two graphs indicating the number of killed and injured. These two graphs, and this is from October 15, so it's a very updated one. Then there was a study that was published in January this year in the Lancet, showing that when you critically review the numbers produced the first 12 months after October 7th, there is actually a 41% underreporting of the numbers, 41%. So if you take the number in this report, the last one, and you multiply by 1.41, the actual number of killed is not 67,000 plus, but 95,000 plus. And if you add to that the 10 to 20,000 lost or buried or missing in the rubble of the bombed buildings, we have surpassed 100,000 killed in Palestine, in Gaza. And don't forget that 3 out of 4 are women and children, and between 80 and 90% are civilians. So those are the rude numbers, the crude numbers. Also important documentation sources are the experiences you have yourself, and my experiences with the Palestinian families, and in particular the patients that I've met. So let me just take one brief story. This is Amal. I will not give her family name for security reasons. Here we receive her in Shifa Hospital in January 2009 during the Operation Cast Lead. She had been buried in the bombed house after a massacre in Zaytun. She stayed there for 3 days, and then she was recovered by her brother. She was nearly dead when she came. She was resuscitated by her team, Palestinian team, and she survived, although with 2 Israeli shrapnels in her brain, too difficult to remove. I followed her and her family. This is her twin brother, Abdullah. Excuse me for the wrong year, it should be 2012. She's carrying this hat because of the pain, the nosebleed, and the air bleed from the 2 shrapnels, but they both do well in school. I meet them every time I go to Gaza, 2 to 3 times a year, and this is in 2022, when she said, when I asked about the difficulties, after she married and got 2 kids, she said, life must go on. That's the attitude of the Palestinian people. I've, of course, been in constant contact with her during the last 2 years. This is from a few days ago. They have been displaced 3 times to the south. She now has 3 kids. All 3 of them have been starving. And she says we cannot go back to Shaya because of the Israeli presence there. She has not been able to find a tent, which cost $900. And she's basically having her whole household in this truck behind her. These are the faces of the victims of the Israeli genocidal attacks on people in Gaza. Do not forget that there are victims from the previous attacks, like Amal and her family. Abdullah, her twin brother, was captured by the Israelis for no good reason and remains in captivity, probably heavily tortured. We wait for him to come back. So Amal and her family are our responsibility. And it is horrible to just see that after 2 years of these horrendous crimes perpetrated in Gaza, it goes on, and we have not been able to stop it. After each bombing, there is hectic activity in the operating rooms. This is in Shifa after one of the bombings, not noticed in the media at all. In September 2019, a young boy who was hit on his motor bicycle delivering pizza. And I can assure you, you never forget the feeling of lifting carefully an amputated leg of an 18-year-old boy, still warm, down to the floor to wrap it up and give it to the family for burial. We have done scientific studies on the amputations caused by the Israeli attacks in Gaza, and we found that the systematic targeting of extremities, arms, legs, knees, ankles, and hands is the same pattern as during the Intifada, when the Israelis do not want to kill, but they want to invalidate and to hurt and harm as much as possible. Every amputation will need 10, on an average 10 surgeries to be able to fit a prosthesis. Now there are between 1,000 and 2,000 child amputees in Gaza, which will need between 10 and 20,000 surgeries just to rehabilitate these kids. So it's imminent to build up again the capacity in Gaza for surgery. So my first point is that the attacks on Palestinian healthcare is very systematic. It's part of their strategy. Let me take you back to 1982, when the Israelis invaded Lebanon, besieged Beirut, cut the water, the food supply, the water supply, the medical supplies, and bombed it night and day. This was my first mission to Lebanon rather, and working together with Palestinian medics. 2 points about this picture. Number one, the majority of the people doing medical work in Gaza and in Lebanon and in the West Bank are the Palestinians themselves. Number two, we could see clearly the pattern of attacks on ambulances, on hospitals, on healthcare personnel, 1982. And there was a commission. It was the McBride Commission. I was a witness for that commission in 1982. And if you look at the second page of the complete report, you can see that the vice chairman was Professor Richard Falk. I suggest we give him a big hand for having been standing out for so long, 41 years. Thank you, Richard. And my second point is that despite all these reports, this is the Goldstone report from 2009. This is the inquiry report from 2014, when the attack was just as bad on healthcare, and the UN report, and also the Tribunal in Brussels, actually documented, and that's important, but it did not change the impunity of the Israeli war machine. They continued, despite all this documentation that we have had through all these years of the same pattern of attacking healthcare, civilians, schools, all these different types of brutal war crimes. So the evidence of the long-standing Israeli attacks on Palestinian healthcare and healthcare workers is overwhelming. I'll just give you, as a scientist, some numbers. This is from the health cluster, which is which has been reporting weekly also from Gaza after October 2023. The yellow bars on this graph are the hospitals that are in function, the gray bars non-functional, and this is 6 weeks, the first 6 weeks after October 7. So on October 8th, there were 34 partially functioning hospitals. On November 14, only 8. This is the result of the systematic attacks on healthcare in Gaza, in order to rob the people of the cornerstone of safety in a society, which is a hospital and healthcare. And when you rob the people of that safety, the intention is, of course, to have more people killed and dying from complications, and it is to kill the will to resist. That's the objective of the attack on healthcare. And the invasion of the hospitals, as you know, has been followed by rampage, by vandalization of MR machines, of ICU machinery, the cancer hospital for children, the cancer hospital for adults. Everything is sort of systematically destroyed. And in 2024, UN reported nearly 600 attacks on healthcare in Gaza. And you know, this is one of the well-known ones, the attack on El Ahli Arab Hospital. And here, Dr. Abu Safiya, the head of Kamal Adwan, still imprisoned, along with 301 other healthcare workers still in prison, being tortured. So the pattern is systematic, attacks on hospitals and on healthcare workers. WHO has a dashboard, and you can see the internet address there, and you can actually search for attacks on healthcare all over the world. And here I've done a search with the search term occupied Palestinian territory, West Bank and Gaza, and you can see the numbers of attacks, of killed, of injured, during the last 2 years, from October 10 to October 22 this year. And the numbers sum up to 2,853 killed or wounded patients and healthcare workers in Gaza for the last 2 years, 4 per day, or 1 every 6 hours. Extremely systematic. And this is a clear modus for the last 20 years, systematic attacks. If you do the same search on the same dashboard, but go 20 years back, which I've done in this search, you can see the numbers of attacks, of killed and of wounded, and I've summed it up for you. So there has been 4,243 Palestinian patients and healthcare workers killed or injured over the last 20 years in more than 6,500 Israeli attacks on healthcare in Gaza and the West Bank. Staggering numbers. With full impunity. They can continue to stop the water supply, the power supply, the supply of medicine, napkins, food for the patients, food for the staff, everything to strangulate and to kill the healthcare system. Completely systematic. And I took this picture in March 2008, one of the Red Crescent Hilal ambulances, and the second video is from February 2024, same. They attack the ambulances, they kill the ambulance paramedics without any mercy, despite the fact that they are marked, uniformed, all according to international law. They are allowed to continue these attacks on the core part of the life-saving system in the society. And of course, we all remember, or we should remember, the numbers. At least 2,415 life-saving personnel, that is ambulance personnel, civil defense, medical staff, have been killed over the last 2 years. And you remember this massacre, which happened March of this year, when they actually executed 15 paramedics, and then it all went silent. Nobody has been accused, nobody has been taken to prison, nobody has been arrested. No names are attached to this heinous crime against humanity. Second point, before I conclude, the Israeli destruction of the preconditions, the fundaments for public health in Gaza. This is a habitat, this is a refugee camp, and these are the 7 key determinants for good public health and longevity. First and foremost, it is water, food, and security. Then housing, work, education, and then comes the healthcare. If you don't have these first 6 provisions in place, you cannot obtain longevity and public health. So what are the Israelis doing? They're attacking the water supply, the food supply, they're destroying the shelter and the hygiene of the people, no soap, no water, no toilet, no showers. They are completely destroying the human security and healthcare. But healthcare attacks is only part of this dynamic circle of undermining the foundations of public health. And you see some of the consequences. The net effect is an incredible increase in mortality and morbidity, all of it avoidable. And we don't know the number of war injured who have been dying from avoidable complications due to infections, due to bleeding, and due to all other sorts of complications that we know well as medical doctors. All systematic. And what is the effect of this? I'll show you. It's a massive negative effect on public health. Let me just give you this very brief little overview of all the society elements that they have destroyed in Gaza. This whole list is, of course, all elements that will provide good or bad public health. So Dr. Youssef Abarish, who happens to be the Minister of Health in Gaza, a good friend, pediatrician, a brilliant leader, has been the staunch leader of healthcare in Gaza for the last 2 years. He told me in November 2023, look, Dr. Mats, it's not the bombing which is the most important. It is the triangle of death, which is starvation, dehydration, lack of water, and diseases, untreated diseases, like cancer, like diabetes, like psychiatric disorders, like neonatal problems, like, you know, the problems connected to delivery, not having a system that could treat it. And if we then add to that, that half of the population is very young, below 18, very vulnerable, you have a system of genocide that is using these scientific elements of knowledge, what creates health, to destroy health. And it shows in the numbers. And I think I want to quote Edward Said, who said in 2002, in fact, I cannot think of any other country on earth that in full view of nightly television audiences has performed such miracles of detailed sadism against an entire society and gotten away with it. 2 minutes, I'm done. Because much of this is so sadistic, it has nothing to do with military control. So life expectancy in Gaza, let's just have a brief look. These are data from 2022, the year before the attack, 7th of October. Look here, life expectancy in Palestine was 9 years shorter than in Israel. 9 years shorter. A mathematical expression of medical apartheid and the apartheid system. If you look at infant mortality, under 5 mortality, and more devastatingly, maternal mortality, you see the fraction 4 times, 3.5 times, and 9 times higher in Palestine than in Israel. But you noted 74.5 years. So what is life expectancy now, after the attack? There was another study published in January this year, very sophisticated study, peer-reviewed in the Lancet. They show that through the first 12 months after 7th of October, life expectancy in Gaza has dropped by 35 years. It's cut in half. It has never, ever been documented in medical science, this dramatic effect on life expectancy. And that means, my friends, that the kids in Gaza can expect to live 44 years shorter than a Jewish child in Israel. Can you have a more dramatic mathematical expression of the injustice and the apartheid than this number? And it's all deliberate, it's all systematic. So, to sum up, the key medical problem is the long-standing occupation and the Israeli impunity. And as Desmond Tutu said, if you are neutral in situations of injustice, you have chosen the side of the oppressor. And I'd like to add this last a few weeks ago front page in the Lancet, which says that most of the medical and surgical societies have kept shut through the last 2 years, and staying silent while pretending to be neutral is in fact a form of complicity. I'm ashamed of the medical societies in the Western world who have kept shut through these 2 years and not for a single time condemned, protested, or asked their governments to take action against Israel in Gaza. We will never forget, and we will never forgive. But we will continue our work. The Gaza Tribunal has produced very important new insight, but the fundamental problem, the root cause remains, and that is the Israeli occupation, the Israeli settler colonial apartheid project, and the Israeli impunity. So what do we do now, my friends? I know for sure that what I will do is to continue advocacy, support our Palestinian brothers and sisters. I will support the resistance and also the Palestinian armed resistance, which is just as legal as the Ukrainian armed resistance against Russia. And I will say to all of you, to resist is to exist, and let us pay tribute to our brothers and sisters in Palestine. Shukran jazilan.